Hi, I'm Dr. Bhuvan Shetty, consultant gastroenterologist and hepatologist, Gleanagles BGS Hospital, Kengeri, Bangalore. So today is World Fatty Liver Day. So we'll just discuss about what exactly is fatty liver. So fatty liver is a very common condition. We usually see it in close to 30% of the population. So the one in three people around us might have fatty liver. So when I talk about fatty liver, it basically means that there's an excessive accumulation of fat in the liver. So there are multiple causes for it. So usually people think that liver disease or fatty liver usually comes because of alcohol. So alcohol is one of the causes, but there are a lot of other causes which can cause fatty liver. So some of the most common causes is one is obesity, diabetes, long-standing uncontrolled diabetes can cause fatty liver, increased cholesterol can cause fatty liver, hypertriglyceridemia, thyroid condition can cause fatty liver. Even excessive sudden weight loss can cause fatty liver in some people. The fatty liver is divided into four stages. So there's only fatty liver. Then people present with fatty liver with hepatitis, where there will be a slight changes in the blood reports for the liver. There is fibrosis, and last stage is cirrhosis. So the first three stages of the fatty liver is treatable and reversible. But once it reaches the stage of cirrhosis, it's irreversible, and most of the times patients end up with transplant. Uh, there are no particular symptoms for fatty liver. So usually patients might just come with a vague discomfort, generalized weakness. So usually it's that's the reason it is called as a silent killer. Patient will be absolutely fine. They just go get some routine blood test or investigation done and might get to know that they are suffering from fatty liver or its related complication. So when the patient comes to us with either if they're suspecting fatty liver or there are some changes, so the routine we get some routine investigations done for the patients to see the liver function tests, so how the liver is functioning, the cholesterol levels, the diabetes and hypertension if it's under control. Ultrasound imaging helps us to diagnose, gives us a vague idea about the stages of the fatty liver. There are newer non-invasive tests like fibroscan, which gives us a very particular what stage of fibrosis or fatty liver the liver is in at that time. The treatment for fatty liver mainly includes lifestyle modification. So, as I told you initially, the main one of the causes are increased processed food, alcohol, fried items can cause uh, uh, increase the risk of fatty liver. So, regular exercise, weight loss of close to 5 to 10% of the total body fat index helps to reduce the risk of fatty liver. Reduction of processed food, aerated drinks, alcohol helps to reduce the risk and helps those lifestyle modification is one of the first step to be taken in the treatment of fatty liver. Then there are some newer medication. There are some medications which we can give which helps to reduce the fibrosis content. Recently, in the last 2 months, there have been some new developments in the new treatment. Sorry. In the last 2 months, there have been some new treatment options which are available, which helps to lose weight and helps to get the fatty liver under control. So, better to meet a gastroenterologist for further treatment for this. Fatty liver is a very common disease involving close to 30% of the general population. Most of the times, the patients have no symptoms at all. That's the reason it's called as a silent killer. Uh, and the best treatment option which is available is lifestyle modification, regular exercise, weight loss, eating a good balanced diet, and avoiding of the processed food is one of the main things. If even after that the fatty liver is persisting, there are other modification medications available for that. So at the end of the day, take care of your health, take care of your liver, eat good food, and have a nice day.